special education monitoring and compliance for the District of Columbia State Department of Education. And Mr. Lodovico oversees the implementation of IDEA services for DoDEA schools. He has been involved with administration of DoDEA special education programming for the past 7 years. Mr. Lodovico is a school psychologist, and prior to joining DoDEA, he served as the Director of Special Education Programming for Virginia's Manassas County Public School System. Thank you all for joining us. So our objectives are listed right here. And Ms. Jennifer, please take it away.
Okay, I'm actually going to hand it off to Dr. Ed Tyner to start with the purpose of the Office of Special Needs.
Okay, great. Well, first of all, I want to say thank you to Vicki and the whole branch organization for having us here. I think it's a great opportunity for OSN to put the word out about resources and supports that are available for military families with special needs. Sometimes that's a challenge for us, and so to have you guys working with military families and to become aware of the roles that we have here at OSN and a lot of the resources that are now available for families, we just welcome the opportunity and are very happy to do that. So the things we're going to look at today is really basically what our office does to support military families with special needs, and then DoDEA will talk about how they support DoD children with special needs within their system. Okay, next slide. Congress created our office in 2010 to enhance and improve the support for military families with special needs. I think that, and then we also inherited the oversight for the IDEA services that are provided within DoD. Okay. So next slide. So for part of our commission is to really work with the Department of Defense education activities since they provide the special education services. We work with the medical departments because they provide early intervention and some of the related services. And they're also involved very heavily in the Exceptional Family Member Program. And so our job is to kind of work with all of those entities to make sure that services for family members with special needs are addressed. Next. This little chart just kind of depicts in a very simple, high-level way what OSN is. As I've already said, we are responsible for IDEA services that are within DoD, and we have an instruction there, 1347.12, which is our interpretation of IDEA. We also have the EFMP program, and we have an instruction there that's in coordination now that we are working on to get published, and it's called 1315.19, and the new name of it will be the Exceptional Family Member Program, and it will incorporate some things that were in the original NDA, the original Congressional Act that set up our office. And then there's also an advisory panel that Congress asked us to set up that we would get information from family members that would be made up of family members for sure. So, and then through all these efforts, there's an overarching committee of senior leadership at the Pentagon that we take issues to. And this is new for us. We have been able to we got it set up last year, and we're getting ready for our second meeting now, so it's something that we're very excited about. So now what I'm going to do is to turn it over to Jennifer to talk a little bit about some of the responsibilities here.
Thank you. So in the last slide, Dr. Tyner described OSN's major responsibilities. Here on slide 7, you'll see that there are 2 DoD instructions or policies that OSN oversees and which are the basis of the DoD's IDEA and EFMP programs. The first is Department of Defense Instruction, or DoDE 1342.12, provision of early intervention and special education services to eligible DoD dependents. You'll also see that referred to as a manual. So if you see DODI or DODM 1342.12, just know it's speaking to the same Department of Defense policy that talks about how we implement IDEA services. So DoDE 1342.12 focuses on the services provided to children with disabilities and their families. This includes special education-related services for children with disabilities who are enrolled in the DoDEA school system, as well as early intervention services provided by the military medical departments. Along with responsibility for writing and publication of DoDE 1342.12, OSN oversees implementation of IDEA services throughout the DoD by working with the services and DoDEA to identify and resolve common concerns with the provision of IDEA services. We also ensure systemic compliance by doing compliance and quality monitoring on an annual basis. We monitor both the provision of early intervention services by the military medical departments and the provision of special education-related services by DoDEA. The other DoDE that was listed up there was DoDE 1315.19. It's in the process of revision right now. The new title is going to be the Exceptional Family Member Program. And Dr. Tyner will discuss that program in a little more detail coming up. I wanted you to know that both of these DoDEs are also published as federal regulations. So, for example, if you went to look, if you were in a state and wanted to look at, hold there please on the slides, if you wanted to look up something that was a regulation for Part B of special ed, you would look for the Department of Ed's regulations under 34 CFR 300. But when you are looking for the DoD's IDEA regulations, you would go to 32 CFR 57. So you can get to these policies or regulations through the CFR just like you can with the Department of Ed's IDEA regulations. And if you wanted to look up the DoD's EFMP regulation, you would go to 32 CFR 75. Okay, so on the slide here, the other area of responsibility we have is for the advisory panel on community support for military families with special needs. So in 2011, Congress established this advisory committee with the purpose of ensuring that the department hears directly about the services families receive related to any adult or child special needs. And we are to use that information to help identify systemic strengths and systemic needs or weaknesses. So OSN has worked with the services to identify panel members and a chair for this panel, and we are now in the approval process and for reestablishment of this panel, and have just gotten word that we should have full approval within the next couple weeks. So this is rolling along. Okay, slide 9 looks at the structure of the DoD's IDEA services. So this is just a simple graphic. If you ever have questions about who is responsible for providing Part B or Part C IDEA services, this will tell you. So DoDEA, which is the DoD school system, provides Part B special education services worldwide to eligible DoD dependents. So they provide these services on any bases or installations that have a DoD school. So not every base or installation has that, but where they do, DoDEA is responsible for providing the Part B special education services. In the United States, DoDEA schools, DoDEA also provides related services. So all of the Part B stuff for ages 3 to 21. You'll see the lower part of the picture says EDIS. What that is the military medical departments each run a program called Educational and Developmental Intervention Services. These programs provide the Part C early intervention services to eligible DoD dependents worldwide. So anywhere where there's a DoDEA school, the military medical service there will provide the early intervention services, the Part C services. They will also provide, EDIS also provides the related services for Part B in overseas locations. Okay.
Great. Now, next slide. Thank you, Jennifer. Now, I want to tell you a little bit about the Exceptional Family Member Program. I mean, some of you may know a little bit about it, and others may not know very much. But actually, it is composed of three components. The first component is the identification and the enrollment of a family member of any age that has a medical condition, or certainly of a school-age children or early intervention child that has a special issue. So the enrollment identification is first, and that's done by the medical departments. The assignment coordination to determine the availability of services at a new location for a military sponsor and his family members. That is also done by the medical and the personnel folks. And so those are two important pieces, and EFMP actually started with those two pieces. Now, because of the legislation, we now have the family support piece, which is done at the family centers on every installation. And this is the area that I think most of you will be most interested in, because what I'd like to show to you is what they do, some efforts that we've done to standardize things across the services for this, and then show you some resources that, as I said in the beginning, that you will have. Okay, the next slide. So the Exceptional Family Member Program for Family Support is provided at every installation in what is called their family centers. Now, each service calls the family center by a different name, but when we say family center, everybody knows what that is. Information and referral are the primary services they provide. They look for services that are on the installation, and they look for services that are in the community. So a family member, a family with special needs can go in and really explore with that family support person what is available for them. They also provide a services plan if the family would like to have that. They do non-clinical case management. And then at the end of the time that the family is going to be there and they're getting ready to move to a new location, they also will assist in a warm handoff if the family would like to have that. Okay, if we go to the next slide. One of the things that we have been working on, and I know this slide's a little bit maybe small, but the point I wanted to show with this one, we have been going through an EFMP standardization process that's really going across all those three components we talked about, that really has a lot of impact on the family support piece in terms of service providers and information for family. If you look at those first years when we first started, a lot of the activities and things we did there really had to do with studies, establishing baselines. We looked at some Medicaid study and some family support issues, how those services work. A newsletter was established, and we began putting together and developing a lot of online resources. If you look at the next block from 11 to 13, this is when we really began a functional analysis of EFP across all the services and across all three of those components to make sure, in fact, we understood the as-is. We looked at 15 different IT systems. We started looking at, we did visits to installations and to human personnel commands just to make sure we had a clear picture of what is out there so that then we could develop a plan to move forward with that. We also began doing some more information, like we did 8 informational brochures. We did over 30 trainings for military families. Some are on webinars, some are district online learning, some are YouTube videos. But we put together a lot of materials out there for family members and for service providers. We also developed, because we had feedback, that a quick reference guide would be useful. For instance, if a family member was on a Navy installation and was going to an Army installation, we now developed a quick reference guide that says what the procedures are and a point of contact for them. So this should be we've heard it's been a valuable resources for the service providers. In that last section, again, we continue to develop more training seminars. We're looking at standardizing forms for the family member travel screening. We have a data repository now that we're just finishing up that will give us statistical reporting, which was mandated by Congress for us to do as well. One thing we have to keep in mind with these initiatives, they will change as we move forward based on the family needs and based on the needs of the military. But we're excited because a lot of things have been accomplished in this process, and we still have a long way to go, and we don't see it as a process that's going to have an end. We see that we've accomplished a lot, and we'll keep moving forward with additional progress. Okay, if you turn to the next slide, yeah, I just wanted to go ahead and outline for you, or just kind of highlight a couple of special things. Now, there are many more things on the Military OneSource website when you go to it, but a couple of these that I thought that might be helpful for you as you work with parents is that the first one, the Special Needs Parent Toolkit. It really provides a lot of information for families from birth to 18, so from the early intervention through 18 or through high school. But it gives them a lot of information on what happens from birth to 3, what happens in special education, when they're transitioning, how they can advocate for their child, and then there are other resources and support that are also included in there. So and it can also be downloaded from Military OneSource. So it's something that is very useful, and parents who have used it have found it extremely useful. The next one I wanted to highlight there was the Special Care Organizational Records, and then we call that the SCORE. And what this does, it will help family members organize their health records. And there are 3 of those actually. There's one for children, one for adults, and one for elder care, because the needs of how you organize those information is slightly different for each. But again, they're all downloadable and easy for parents to use. And the Military OneSource Specialty Consultant, the third one there, is 24/7 master's level counselors who can take a call from any parent and try to hook them up with local resources. Now, obviously, if they call in the middle of the night on a Saturday, they probably can't hook them up that night, but what they will do is take their name and information and get back with them. If they call during a time when they can be hooked up, they will actually keep the family member on the line, make the connection, and then put them together. So this has been a very successful program when families feel comfortable using it. As you know, some families would like some means of getting information and assistance, and others don't, but this is one that has been very, very popular for us. Okay, on the next page, there's some additional resources here that on the left side in the green, the first 2 are actually for service providers. It gives them a guide and then how to use that guide and really providing support for families with military special needs. And actually the next 2 are a repeat from what was on the other page, and somehow I overlooked that when we did the slide. Okay, in the blue column, we do have a online magazine, an e-magazine called The Exceptional Advocate. Right now we have about 6,500 subscribers to that. It's bi-monthly. We're just now going through a brand new redesign of that, which we're very excited about. And anyone can subscribe to that. So even if you, as in your parent centers, would like to subscribe just to have that, you're more than welcome, and we can tell you how to do that. The second one there is a directory of what's available overseas. You may find that useful at points, but I'd like to just end with talking about the Educational Directory for Children with Special Needs. The way this directory is set up, it has school-age directory and it has an early intervention directory. And what happens is if you go, you can click on a state. Say you click on the state of Alabama. What it will do is give you the school-age directory, if that's the one you choose. It will give you descriptions of their special education system and their related resources. It will give you district profiles and content information. It will give you tools for making the transition better. It will link you to national resources. There is a tool in there called Tools for Making a Smooth Transition, which will give you several ideas on how to work with collecting records and making contact with the new school where you're going. A lot of tips in that. Then once you look at the state, you can then go over and click on local schools, and you can either look at it by, it will give you a choice to look at installations in that state, and if you click on installations, it will show you every school system around that installation. Then you can check on just the state itself and schools, and it will tell you which installations are close to those schools. So, and it will tell you the number of students with disabilities served. It will tell you information about insurance coverage for autism, spectrum disorder services, any transition resources, parent training, like where the centers are for parent training. So there's a lot of information there that's available for parents, and we've heard that some parents, even with children that do not have special needs, have also found this resource available or valuable to them. Okay, with that, I'm at the end of the OSN slides and would be happy to take any questions you might have.
All right, and we don't have any additional questions coming through yet. If anyone would like to post questions in the chat box or state them out, please do so. We will continue with an additional question and answer session at the end of the DoDEA piece. Thank you. Mr. Lodovico, it is all yours.
Good afternoon, everyone. The Department of Defense Education Activity, our school system was created in the 1940s to serve our military families overseas. About 50 years later, the Department of Defense established schools in the United States, primarily in our southern states. DoDEA is a federally operated school system servicing students pre-K through 12. DoDEA serves approximately 76,000 students in 7 states, 12 countries, and also in Guam and Puerto Rico. Our mission is to educate, engage, and empower students to succeed. We are divided up into 3 administrative areas. The domestic dependent elementary and secondary schools is in the United States, and we refer to these schools as DDES. Overseas were the Department of Defense dependent schools Europe, and they are referred to as DODS Europe, and then in the Pacific, DODS Pacific. We serve students with disabilities ages 3 through 21. Our procedures are governed, as stated earlier, by the Department of Defense Manual 1342-12, which is aligned with the Individuals with Disabilities Education Act of 2004. We serve approximately 8,500 students in our school-based programs. Our special educators, like in the States, must be certified to teach in the area that they are teaching. Our staff works collaboratively with our general education staff to serve students with disabilities. All students are served under an IEP. Any additional information that you may want, you can please check our website. I'll be happy to answer any questions if anyone has a question.
Mr. Simon, would you mind unmuting all of the phones? Okay. Are there any questions? Okay. Well, we would like to thank everyone for joining us from the branch team. If you would like more information, please go to www.branchta.org. Jean Cosenza is typing from Western New York Parent Center. She just talked. Oh.
Yeah, we'll be happy to take any questions or comments you have.
While Ms. Jean is typing, I'd like to let you all know up in the files section, we have several items available for download, including this webinar. We will have this recorded and available on our website and through YouTube. We have 3 of our informational pages that we have devised, and they are the Department of Defense Education System, the Exceptional Family Member Program, and the Interstate Compact. We have also provided 2 additional items from this presentation, the slides that provided the Exceptional Family Member Program flyer, as well as the completed activities, the EFMP graph. We'll just give a few moments here. But these items that we have shown here in slide 23 can be used to further understand the programs listed above, build your parent-centered capacity to help military families, and we want to also show identifying ways to work with these programs for the benefit of military families.
And Vicki, I will just say, this is Ed Tyner again. Any questions you get later, or we'll be happy, Jennifer and I, to certainly help address those.
Okay, so we have a question that did come in. It has been difficult to speak with anyone at Military OneSource. I am with a parent center and looking to obtain information from them. They stated that I had to have families call them first. Would you mind addressing that, Dr. Tyner?
Sure. Yeah, we just did a visit there a few weeks ago, and Jennifer, you can step in here and help. It seems that their contract is set up for them to talk directly to military families. Other people, the service provider like Jane, could go in and download information that is there, but to actually talk to like a specialty consultant, they really have to, I think the way their contract is written, they have to track, not necessarily, well, I guess the person they're talking to, but they have to show that they're actually talking to a military person. Was that your understanding, Jennifer?
Yep, that's how I understand the services, that they are provided directly to military.
Now, the resources that are online, anybody can download those, like the toolkits and the guides, and there's plenty more things that are on the line on the website that we didn't talk about today. So if you go to Military OneSource and go to specialty or EFMP special needs, you will find all kinds of other fact sheets and other resources there.
All right. Thank you, everyone. And if you do download this PDF, every item that we have mentioned in green is actually hot linked to the website that you could get the information from. We appreciate everyone's time today. Thank you for coming, and we'd like to give a special thanks to Dr. Tyner, Dr. Masoodi, and Mr. Lodovico. Have a wonderful day.
Thank you.
Thank you very much.
Okay, Vic, I'm going to leave this up for a couple minutes just in case people are downloading the documents.
Hello?
Hello?
Hi, it's Susan Jackson again. I tried to send your email and it came back. Can we verify it? Your email address? And so is it NATALIJA?
Okay, just in case I'll spell it better. N is Nancy, A is Apple, T is Timothy, A